Hello everyone, my name is May NC Dawing and I will be presenting First Aid for Nosebleed. So these are my objectives. The first one is to define terms and concepts used. Second is to learn what is nosebleed and why it occurs. Third is in this presentation you'll learn to administer first aid to someone suffering a nosebleed. What is nosebleed? Nosebleed, also known as epistaxis, is bleeding from inside of the nose. Blood can also flow down into the stomach and cause nausea and vomiting. In more severe cases, blood may come out of both nostrils. Rarely, bleeding may be significant that low blood pressure occurs. For the definition of terms, first one is epistaxis, which is bleeding of the nose from inside of our nostril. Second is one of the major types in nosebleeds, which is the posterior nosebleed that involves bleeding from the back of the nasal cavity. Blood flow tends to be heavier than in anterior nosebleeds. Second is the anterior nosebleeds. An anterior nosebleed starts in the front of the nose on the lower part of the wall that separates the two sides of the nose, called the septum. Capillaries and small blood vessels in this front area of the nose are fragile and can easily break and bleed. When will you know when you are experiencing nosebleed? First, you will see blood in the nostrils. You will feel dizzy and weak, feel the warm blood in the back of your nose, and you'll probably have difficulty in breathing and the urge to swallow. There are two major types of nosebleeds. The first one is the posterior nosebleed, which happens in the nasal septum in an area called the Kieselbach plexus, where four different arteries come together to form blood vessels. The Kieselbach plexus is a vascular network formed by five arteries that supply oxygenated blood in the nasal septum, which refers to the wall separating the right and left sides of the nose. Also, did you know that the Kieselbach plexus was named after Wilhelm Kieselbach, a German otolaryngologist? He is a head and neck surgeon. And the second type of nosebleed is the anterior. It is caused by irritation in the blood vessels in the nasal septum. This shows where anterior and posterior nosebleeds occurs with its description. What are the causes of nosebleeds? First one is nose picking, colds and sinusitis, blowing your nose with force, inserting an object into your nose, injury to the nose or face, allergic and non-allergic rhinitis, cocaine and other drug inhaled through the nose, chemical irritants. In high-altitude places, the air is thinner, which means there is a lack of oxygen, and that's when you get nosebleeds. Deviated septum. It is an abnormal shape of the wall that separates two sides of the nose. Some of the people have this. And last one is frequent use of nasal sprays and medication to treat itchy or runny or stuffy nose.
Nosebleeds are common. When there is bleeding from either or both nostrils, how do you handle it? Sit upright and lean forward. Pinch your nose. With thumb and index finger, apply pressure on the soft part of nostrils below the nose bridge. Continue applying pressure until the bleeding stops. Try to breathe through the mouth while nostrils are pinched. After 10 minutes, release the pressure on the nostrils and check if the bleeding has stopped. If bleeding persists, seek medical aid.
This is the step-by-step procedure on how to administer first aid on nosebleed. First is to sit down and lean your head forward. Using your thumb and index finger, firmly press or pinch the nostrils closed. Third, continue to apply this pressure continuously for 5 minutes. Check and repeat until the bleeding stops. Now, if your nosebleed continues for 20 minutes or longer, seek emergency medical care. The person should also receive follow-up care if an injury caused nosebleed. These are the do's and don'ts when experiencing nosebleed. Do pinch the bridge of the nose and lean forward slightly, holding pressure for 5 minutes. Time the nosebleed and record the information to share with your care provider when you follow up after nosebleed. And do rest after nosebleed to avoid reoccurrence. Now, if dry air seems to trigger, you could counter it using a humidifier. You could buy it in Shopee. Don't lie flat during a nosebleed kasi parang malulunok mo. Don't pick or vigorously blow your nose. You'll trigger it, I swear. Don't bend over for a long period of time. And don't eat warm and spicy food. Why? Because heat causes blood vessels to dilate, thereby precipitating bleeding. You should consume nothing by mouth that is warmer than room temperature for 2 weeks. Avoid hot showers and hot baths.